I'm Ken Faust. I work for the Dougherty County Sheriff's Office. I'm over the uniform division over there. I've been there for 30 years. You don't get in it for the money. You don't get in it for the fame or glory. It's a calling to help people, and that's the reason I started in the Sheriff's Office. Overall health, I've been losing weight, trying to exercise, watch what I eat. Never had any health issues except my sugar, and that's it. I'd put our daughter to bed around 9:30, and I got into bed around 11, and I had some tightness in my chest. All of a sudden, like someone was stabbing me in the chin with an ice pick. I'm talking about just terrible pain in my jaw. I got up and I called a family member to come get my daughter, and then I called 911 here in Terrell County.
Started with a call from dispatch because we were asleep at the time. Well, when I got there, he was outside his home, and he was telling me, he's like, you know, my chest has been hurting for almost an hour now. We got him inside the ambulance and started running some tests on him. I was like, okay, let's get the full picture. So we went on and captured a 12 lead and showed remarkable findings that kind of line up with like an inferior MI. So I was like, we need to go to the hospital. Let's start heading that direction. Fresh out of paramedic school, and even during my times as an EMT, this was one of the very first STEMI that I was in charge of and actually, you know, patient care for. If anybody in EMS never tells you they're not anxious on these calls, they're probably lying to you. There's a degree of chaos going on in the head when you see stuff like that. But muscle memory kicks in, your training kicks in, you identify, you act, and you follow your protocols and give them the best care possible. We have these Zoll monitors on our trucks that allows us to capture EKGs and transmit them to the hospital. And we usually follow up with a radio call or a phone call to speak with a doctor, make sure they've gotten these images we've transmitted to them.
So the Phoebe Foundation gave us grants that allowed us to place on all the ambulances, not only just in Dougherty County, but the surrounding counties, and place devices on the ambulances that allowed them to electronically send EKGs before being here. The ability to put these devices on all the ambulances, allow them to transmit EKGs here, allows us to start pre-hospital care, administer medications before they arrive at the emergency room, have the whole team ready when the patient gets to the emergency room, really allows us to escalate the care.
They were communicating with Phoebe the whole time we were going to Phoebe about, you know, my status. I texted my wife, told her, even though she was on a cruise, I texted her saying, hey, I'm sorry, something's going on, I got to go to the hospital.
During the entire duration of the transport, the patient was in good spirits. He was talking to me, he was communicating with me, never really had any mental decline or altered mental status or anything. We got him in there into the resus room, got him moved over from our stretcher and onto the hospital bed, and just about that time, patient went unresponsive. It just went downhill really fast.
When I walked into the emergency room here, they were doing chest compressions because he had one of the lethal heart rhythms that can occur with myocardial infarction. We call that ventricular fibrillation. Sometimes it's something called ventricular tachycardia.
I remember them pushing my chest. I knew I was in God's hands right then. I was never scared.
So they had already shocked him a couple of times when I rolled in. We looked at the EKGs, said he was clearly having a heart attack and were unable to maintain sinus rhythm. So they proceeded to put a breathing tube in his lungs so we could support his respiration. People were pressing on his chest. We have a whole variety of people kind of changing roles because it's fairly vigorous activity. I started some other medications, some antiarrhythmic medications. We shocked him several times, had to shock him back to back. We were able to get brief periods of what's called sinus rhythm, that's normal heart rhythm, but then he would deteriorate into this ventricular fibrillation. So we gave a variety of other medications to try and see if we could stop that. Finally, we were able, after we had shocked him many times, probably I know that I had personally shocked him at least 50 times. We were able to maintain a sinus rhythm, so we quickly took him upstairs to the cath lab, wherein he promptly arrested again, and we did more CPR for another 15 or 20 minutes and shocked him again. We probably were doing CPR and, if you will, coding this gentleman for at least an hour.
That's what you call dedication, commitment to craft. It was just an amazing feat that team did. They kept the faith. They could have gave up, and they didn't. And that's what's amazing about that team.
Finally arrived at a point where we were able to get a stable rhythm, get him on the cath table, and very quickly I was able to assess that his right coronary artery was occluded, which we knew from the EKG, and opened that up. And by that time we got what we would refer to as hemodynamic stability. In other words, the blood pressure was okay, the heart rate was okay. He was on a breathing machine, he was sedated. Then we took a picture of his heart muscle and looked at his left system and found that in the other artery he also had a critical narrowing in his main artery over the front of the heart, about 95%. We elected to, because of the gravity of the situation and the hemodynamic instability, to open that blood vessel as well. Then we were able to get him up to the intensive care unit, at which point yet another team comes into play for neuroprotection. None of the stuff that happens out of the hospital in the emergency room in the cath lab counts if you can't get them through the intensive care unit stay. So you have to have meticulous ICU care. We've got critical care staff here 24/7. So that's a whole nother thing that has to fall. Everything's got to fall right. And we're all integrated as part of a healthcare delivery team for this purpose.
The good Lord blessed me. I'm going to tell you, the good Lord watched after me this entire time. The people at Phoebe that took care of me, they're touched by God.
And at around 48 hours, they were able to wean things away. He started moving things and very rapidly was taken off the breathing machine and awoke and was feeling fine. As I said to he and his wife, when he was awakened and extubated, I said, for a guy who ought to be dead, you look pretty good. And he did. He was conversant and could remember many things and neurologically intact. This was really, to my mind, pretty spectacular. I won't say a once in a lifetime, but it's a very rare event. Underwent cardiac rehab out of the hospital and has continued to improve, which is just a testament to all the things that have to go right. But if you don't have a team in place, you can't get to the point where you can survive.
I'm proud of my team, the crew, proud of the hospital. It's a good feeling knowing your local hospital has that level of patient care. Just trying to render the best patient care possible for them and, seeing a positive outcome from it, it's a good feeling inside.
I think it's a credit to all the members of the team that took care of him and participated in his care. A goal without a plan is just a wish. You have to have a plan. And hope and prayer are not a strategy. So you actually have to think about these things, how you're going to approach these critically ill people, because you can't figure it out in the moment. You got to really have all the parts and all the pieces, and then they all have to fall in place. But when they do, you get these kind of spectacular outcomes that really emboldens you to think about the future and things that you can do.
I would thank every one of them and tell them how much I appreciate, my family appreciates them. The job they did that night and through this whole thing has been nothing but exceptional. You think you appreciate people, but you appreciate people more, and especially your family. God touched this. He touched me. He touched everybody involved. Glad to be here. I really am.
Good afternoon. I have the pleasure of introducing the care team involved in Mr. Faust's case. We have EMS Tristan Smiley, AMET, Jared McDonald, paramedic, Charleston Holloway, ER nurse, Donald Tollefson, ER nurse, Dr. Cohen, interventional cardiologist, and our CAF team, Kelly Hill, RN, Kelly Pantone, Radiology Tech, and Melody Sauls, RN. And now I am honored to welcome our Y, Mr. and Mrs. Ken and Billy Faust.
Well, I want to say thank y'all and Phoebe for inviting us to come up here. We sat here since 12 and I learned a lot of stuff I didn't know about hearts, so appreciate like I said, it's a servant's heart that y'all have, I have. It's people who go to school, who learn, and I appreciate that. When he was talking about, he put me on the machine and he said he's got an upside down fireman's helmet. I said, what are you talking about? And me being in law enforcement, we don't like to excite people when something's fitting to bad happen. And I said, you can go ahead and tell me. He said, you in bad shape. So I walked in, got into the ambulance and sat down and he hooked me up and he said, we're going to transmit this to Phoebe. I said, you ain't going to transmit it right here. He said, what are you talking about? I said, because you ain't got any reception. I said, you got to get past this road up here before they're going to get what you're supposed to be sending them. So we're going in the ambulance and I'm texting my wife, even though she's on a cruise ship in the Gulf of Mexico. I'm saying, I'm sorry, it's going to the hospital. But the dedication of people like y'all, I appreciate. And that's all I got to say.
Thanks, Sheriff Faust. So it was our pleasure to take care of Sheriff Faust. Want to thank everybody for having us, Jeff for having us up here. You know, being in Southwest Georgia, we're relatively isolated. It is, to me, looking at these conferences, it's a call to action for industry. We need smaller ECMO devices that are more readily applicable at a wider variety of places. It's probably the last step for us. We've not moved into ECMO, not because of the technical challenges of cannulating people and the devices, but it's all the other stuff, the people that care for them, the nurses, the nursing staff. Every time we've kind of gotten up to that, the pushback has always been, we can't do it, we don't have the staff. And so it's a leap for us. We can do, you know, some of the mechanical support stuff, but I think it is a call to industry. The Impella is a good thing. You know, they're clearly moving to smaller devices that are more readily usable for longer term. We need right-sided devices that make this technology available in something smaller than you know, really academic institutions. But it's a goal for us. It's something that we've got to go to. It's the next level for us. The part of that is the process that we've already done. Joining this, the EC3 community has really kind of helped us understand the need in our area, and we are kind of an outpost. We're out in the middle of nowhere, a long way from any place else, but it's because of our friends up in Atlanta at these various institutions. When we can stop something, we have somebody to reach out to advance care to. Our goal is to be able to be that place for our community, but it's going to take a while. In the meantime, I think this is a great, it was a great show. It's a great series of talks, and it does help us kind of frame for all of us what the goals, what's out on the horizon. You're only limited by your vision, and if your vision gets too limited, you get too wrapped up in the day-to-day care of taking care of people, and we don't want to do that. We're trying to advance care because of these kinds of stories and these kind of outcomes, and the stuff that came out of Canada and out of Minneapolis last year, we heard it's just spectacular. I think, you know, when Jeff and I finished or actually finished my fellowship a little before his, but in the 1980s, if you told people that this was going to happen during the course of our careers, they would have wondered what you were smoking at night. I mean,
You know, you're putting in valves without opening up people's heart. You're putting people on heart-lung bypass machine, but you're not in the operating room, and they're surviving. I mean, it's just a testament to the community, to the scientific community, and to the clinical community. Once again, thank you for having us, and we really appreciate the efforts of the conference.
So I want to tell you the rest of the story. Serendipity, whatever you think it is. Dr. Cohen was one of my attendings when I was a fellow. He's one of the people that taught me how to cath. He came from the University of Alabama in Birmingham. I think he was the director of the cath lab at our VA hospital, and he is somebody that taught me how to do what I do. So this is all a full circle. We're so glad that you were there for the sheriff. We're so glad that you were there, and I'm so glad that y'all are here. This is the end of the conference. We look forward to doing it next year, and I hope that this last story, these are the important things. This is why we get up every morning to do what we do. So I hope it invigorated you as much as it invigorates me, and I'll see you next year.